Government is continuing with plans to protect residents in the event that someone is diagnosed with Ebola here in the Virgin Islands. Government began taking proactive steps over several weeks to respond to the Ebola virus through planning and mitigation measures to manage the impact of Ebola should it affect the territory. Infectious disease specialist Dr. Corey Ford of the Queen Elizabeth Hospital in Barbados spoke with Government Information Service.
I've looked at, had the opportunity to meet with many people at many different levels, at the hospital level, ministry level, and this morning at a different high-level meeting. And I think on paper, certainly, I think I can best assure the public within the Tortola that from what I see, there's been a lot of preparation being put in place at all of these levels. And I would caution one thing. We need to, as it relates to Ebola virus disease and how Ebola will or can get into the region, and it really will come through our ports of entry. I think that's a very important point from my perspective in terms of infection control. And I think when I say that, what I'm trying to say is I think we need to strengthen our surveillance at our ports of entry. I think the ministries, from discussions, are very well aware of that, and they're putting measures in place. But I think that's going to be a very strategic point. And strengthening that area would, when I say that, I need to be very specific. What I mean, you need to evaluate people as they come in. You need to give them information at the airport, for example, in terms of signage. You need to, of course, educate the individuals who are actually involved in dealing with passengers as they get off a plane or get off of ships, etc., yachts, etc.
As part of Ebola preparatory efforts, quarantine facilities have been identified at People's Hospital and containment arrangements have been made at all main ports of entry. The BVI Health Services Authority has developed a refresher training program for all frontline health staff, both public and private, in the use of personal protective equipment and universal precautions for management of persons with infections. The training efforts are intended to ensure that staff is able to treat potential patients safely while minimizing risk to themselves.
I think there's nothing stronger than educating your clinical staff. As I said before, don't be fooled. Like myself and other physicians and nurses and environmental staff, and everyone is nervous. And they often wonder. I think you need to alleviate some of the fear by education, about educating people, about what is reality and what is fiction. So I think education is important. As you also have to learn from the experiences of others. And it sounds like a straight statement to make, but I think a lot of our focus should be looking at some of the experiences the rest of the world had. For example, Senegal and Nigeria, WHO has now said, are Ebola free. Is interesting. Look at the experiences as what happened in the USA. And I think what this comes back to is that hospitals all over the region really need to strengthen the infection control protocols within their hospital systems. I think that is quite clear. And I think that by doing that, it helps alleviate some of the fear. There's nothing more important in this particular scenario as well, not only educating staff about the disease, but actually having drills. So it's okay to write a plan, but plans are paper.
Right.
But doing an actual drill and training staff how to use this equipment, how to put it on, how to take it off, are some of the things that I'm really emphasizing while I'm on this brief trip.
The Ministry of Health and Social Development, through the Health and Social Service Committee of the National Disaster Management Council, is leading the charge on Ebola mitigation. According to GIS, the committee is scheduled to meet again at the end of this month to review arrangements at the health facilities and ports of entry.